They also return to their normal life. Or I have taken antibiotics again and again, but nothing helped. Many men come to my clinic saying, "Doctor, I have burning while passing urine." Prostatitis. Why prostate pain persists and how is it actually treated? Many men come to my clinic saying, "Doctor, I have burning while passing urine. I feel pain between my legs." They may also complain, "I have discomfort after ejaculation." Or I have taken antibiotics again and again, but nothing helped. Some are even told that you have prostatitis. But no one explains what that really means. So let me start with an important reassurance. Prostatitis is common, misunderstood, and very treatable when approached correctly. In this video, I'll explain what prostatitis is, why symptoms persist despite normal tests, different types of prostatitis, why antibiotics often fail, and what truly helps prostate patient recover. First and foremost, the most important thing is prostatitis does not always mean infection. In fact, most men with prostatitis symptoms do not have bacteria. This single misunderstanding leads to repeated antibiotics, prolonged symptoms, and anxiety, frustration. Understanding the type of prostatitis is the key to effective treatment. Now, going back to the basics. What is the prostate and why it causes these confusing symptoms? So prostate is a small gland which is located just below the bladder. It is about the size of a walnut. It surrounds the urinary passage and contributes to the seminal volume. Because of its location, prostate problems can cause urinary symptoms, sexual symptoms, pelvic pain, and perineal discomfort. So the pain can be felt in, maybe lower abdomen, your groin, your testicles, or inner thigh and lower back. This wide symptom range often confuses patients and equally true doctors. What is prostatitis? Prostatitis means inflammation or irritation of the prostate, not necessarily infection. It can present as burning urination, pelvic or perineal pain, pain during or after ejaculation, urinary urgency or frequency, and discomfort while sitting. Symptoms may be constant or fluctuate in cycles. Talking about the types of prostatitis. Prostatitis is classified into four main types. First, acute bacterial prostatitis. As the name suggests, it will be sudden onset. Many times, patient complains of fever with chills, severe pain, and the urine test turns out to be positive. This is a medical emergency and requires antibiotic. Second, chronic bacterial prostatitis. It presents with recurrent infection. There is a temporary relief, although with antibiotics. Many of them relapses. This is uncommon but real problem. Third, chronic prostatitis, also called as chronic pelvic pain syndrome. And mind you, this is the most common presentation. There's no infection, but patient comes with a long-lasting pain and with normal test. This accounts for over 90% of our cases. And last, the fourth one, asymptomatic prostatitis, which is found incidentally. There are no symptoms and it doesn't require treatment as well. Why most prostatitis is not infection? In chronic prostatitis, or also called as pelvic pain syndrome, the urine cultures are negative, the semen cultures are also negative, and the scan is also normal. So the problems lies in pelvic floor muscle spasm, or it could be a nerve sensitization. It could be inflammation, which could be without bacteria, and obviously a stress-related muscle tightening, which can give rise to the symptoms. And this explains why antibiotics don't cure most cases. Now, talking about why antibiotics often fail and cause harm, because repeated antibiotics, they do not help non-bacterial prostatitis. In fact, they can irritate the bladder and disrupt gut health, leading to more anxiety. The temporary improvement often occurs due to an antibacterial effect and or placebo effect. When symptoms return, patients feel hopeless. So the correct diagnosis can prevent this cycle. Talking about the pelvic floor connection, many men with chronic prostatitis have pelvic floor muscle dysfunction. And what does it mean? It's nothing but tight pelvic muscle, and it can lead to compression of the nerves. It can increase the prostate sensitivity, often causing pain during sitting or ejaculation, and it can mimic the prostate pain. This is why strengthening exercises worsen pain, but the relaxation-based physiotherapy helps. What is the correlation between stress, anxiety, and prostatitis? Stress does not cause prostatitis, but stress definitely tightens the pelvic muscles. It sensitizes the nerves and thus increases the pain perception. So this creates a vicious cycle where the pain increases the anxiety and the anxiety leads to muscle tension and it causes the increased pain. So breaking this cycle is a key part of treatment. How do doctors diagnose the prostatitis properly? Diagnosis is clinical and very much structured. It involves a detailed history where the duration and pattern of pain is understood. It often requires a urine and infection test to rule out the bacteria and a pelvic floor examination. Advanced tests are done only if there are red flags. Talking about treatment, it's a multi-layered approach. Effective treatment focus on only contributing factors. Many times, education and reoccurrence suffice. Pelvic floor physiotherapy, sometimes we give muscle relaxation techniques. We also advise bladder and bowel regulation. There are certain pain modulating medication which are required, and obviously stress regulation, which will help a lot. So no single pill cures prostatitis. It's a coordinated care which does help. What is the role of pelvic floor physiotherapy? Pelvic floor physiotherapy is often the turning point. It helps by releasing the muscle spasm, by improving the blood flow, by reducing the nerve irritation and thus restoring the coordination. Many men improve only after physiotherapy is introduced. Medication. There are certain medications which can be used like anti-inflammatory drugs. There are no pain modulators and muscle relaxant. So these do not cure the infection, but they can calm the irritation. Treatment is individualized and it's time bound. Correlation of sexual symptoms and prostatitis. Painful ejaculation and the reduced sexual confidence are very common with prostatitis. The important reassurance factors are prostatitis does not cause impotence. Fertility is usually unaffected and the symptoms improve with treatment. So addressing pain restores confidence and the sexual function. So what patients should stop doing? To recover, patients should stop repeated antibiotic without infection. They should stop internet searching about this. Avoid intimacy due to fear. They should stop sitting for long hours without breaks. And they should start thinking that recovery is possible. Prostatitis is frustrating but manageable. What is the long-term outlook? Most men with chronic prostatitis improve significantly. They learn to control flares. They also return to their normal life and regain confidence. Sure, the recovery is gradual, not instant. So the goal is to control and not perfection. Take-home message. Prostatitis is real. Persistent pain does not mean persistent infection. Normal test does not mean imaginary symptoms. So with correct understanding and multi-layered treatment and patience, pain reduces, the urinary symptoms improves, and the quality of life returns. So in this, you are not alone and you are not beyond help. Thanks for watching this. If you like this video, kindly share with someone who needs it. Thank you again.